Good afternoon, and welcome to today's presentation, Components of a Successful Long-Term Recovery Program. I'm Julie Miller, Editor-in-Chief of Addiction Professional. Today's program is a Foundations Recovery Network webinar sponsored by Millennium Health. Thank you to our sponsor and to everyone in our audience for giving us your time and attention today. Before we get started, we do have a few details to share with you. You'll notice that each window on your screen can be moved by clicking and dragging, or enlarged and minimized by clicking on the icons in the top right corner of each window. Please use the Q&A area to the right of the slides to submit a question at any time. You don't have to wait until the end. But if you can't see this area, simply click on the red Q&A button. You might want to download a copy of today's presentation. And to do so, please click on the link in the Resources area in the lower left of your screen. If you have any technical issues during the program, please click the yellow Help button, and we can definitely help you troubleshoot the issue. We also have a special note about CE credit. To receive credit for today's program, you must click on the green CE certificate button at the conclusion of the program and complete the evaluation form. If you're watching today's program in a group, please download the group submission guide and program evaluation form located in today's resources list and follow the instructions. If you have any issues with this process, we ask that you do not reach out to today's sponsor. They will not be able to assist you in receiving your certificate. Please note that CE credit is not available for the archived webinar. It's only available for the live event today. Finally, you can also tweet during today's webinar via Twitter. Just click on the blue Twitter icon at the bottom of your screen, then click the Post and Authorize buttons to log into your Twitter account and begin sharing automatically the event hashtag #APLiveWebinar. At this time, it's my pleasure to introduce our speaker today, Ken Seeley. Ken Seeley has remained professionally and personally involved in recovery since his sobriety date in 1989. He applies his relevant experience to change the lives of people who suffer from the disease of addiction, including their family and their friends. Ken works to save lives every day as the founder of Intervention 911, one of the most prominent private intervention services in the country. Ken is featured on the Emmy Award-winning and Emmy-nominated A&E television series, Intervention. Ken, thank you so much for taking the time to speak with us today. And with that, I'll turn the audience over to you.
Thank you, Julie. I really appreciate it, and excited to be here today. And thank all of you for being here and working together as a team. I think it really takes all of us to make a difference and fight this battle of addiction that is an epidemic in our country. I was going to try to tweet while I'm doing this, but I think that's just a little too much, so I won't go there. But I'll look at them later. So any questions you have, I could answer them through there too. Again, thank you for being here today. I really feel like it is so important that we all work together and we figure out a way that we could help these people that are out there suffering. And we have the evidence base that has random drug testing that helps millions of people in this country, and they're able to reach the 80 to 90% success rate after a 5-year period. And I feel like, we've been keeping this a secret to the general public for so many years. And now it's time that, we open up the doors to the general public and we give them the treatment model that has been working. So that's my goal today, is to convey with all of you about the 5-year plan and how important it is that, we get this message out to the general public. So with that, I would like to start off with finding out who we're talking with today. So on the questionnaire here, if you're a counselor, a therapist, a clinician, an interventionist, a family member, or some other part of person that's participating in today's, please let us know, or please let me know, so I could address the presentation in the appropriate manner. Go over to where the percentages are. And we have most counselor and therapist. Thank you very much. So going into the beginning of the presentation, the 5-year plan has been something that we've been focused on for many, many years, and we'll go over that today. The international crisis that we're faced here with is all over the media. We all see it every single day. Open up the paper today. I mean, these are just old ads that I found, but open up the paper today, and I guarantee you will find something about an addiction issue, and it's devastating to see that it's killing. The last statistic I heard was 125 people a day from opiates alone. And what can we do? What are we going to do? It's all kinds of addictions out there, all kinds of addictions. They're killing our loved ones, they're killing our family members, and they're killing our patients. So what works? What works? What is the thing that's working? Well, most of them start off with an intervention, some form of an intervention. And if you really look into, programs that have that effect, of an intervention starting off, that's really the key component, in my opinion. Not only because I'm an interventionist, but because I really believe that is so important for every single person that checks into treatment, that we have some form of an intervention. Where we see that working is, if somebody in drug court, they have an intervention. If we're dealing with the pilots program, they have an intervention. And if we deal with physician assistant programs, we deal with intervention. So let's see if we can move forward. The pre-intervention, when we do an intervention on A&E, there's the intervention show, which I've been so fortunate to be a part of got over 10 years now. There's a pre-intervention, there's an intervention, and then we send them for 90 days of inpatient treatment. What we've seen here in the Business Insider, there was an article recently that over the 276 addicts that were intervened, only 6 of them decided not to go. And out of 270 people who went to treatment, the 55 of them are still clean and sober. And I'm not sure if I really believe that statistic, because they're self-reporting. So I'm not really, I don't know if that number is absolutely correct, but it is a higher number than what we're normally used to seeing in treating addiction. So self-reporting, 55% still sober, still much better than the statistics that we're normally seeing in treatment alone. If you look at the drug court programs, the drug court programs are one of my favorite in the country. We have, programs that are in every state. People are getting sober through them. This one is Dr. Judge Joanne Ferdinand. I was with her, fortunate enough to be a part of her program. It starts with 3 phases. And the 3 phases are, 90 days of inpatient treatment, continuum random drug testing, which I think is really important to measure the accountability for the addict. Like I said, with the intervention show, I don't really trust self-reporting, but these have random drug testing that back up their results. They have an intensive case management program that they also do. And usually most drug courts are 18 months to, 2 years. And with that, they're getting really, really high rates of success. Her rate is 76% successful that finished their 2-year program. So again, this rate is much higher than the intervention rate that we just talked about at 55%. But this one I absolutely believe in because, they are backed up, again, with the random drug testing. There's other drug court programs that we've contacted that are all over the country, Hawaii and South Dakota. Their reports in Hawaii is, 6 years is 61%. South Dakota is 66%. So they're really getting, these great success rates, and self-admit patients aren't getting these rates. They aren't getting these rates. And I'll talk a little bit, as we go along here about the insurance carriers. They're really upset that we're not getting these type of rates where drug court's able to get and the intervention show. And then we go into the doctors' diversion programs, the physician health programs. These are all over the country also. Unfortunately, where I live in California, they discontinued it a while back, but I think I heard that they're working on getting it back enforced, where, doctor diversion, as you all know, a lot of you are clinicians here, but for the family members that don't know, there is a program that, doctor diversion programs, that if you are a doctor or a lawyer or a pharmacist, a nurse, any high licensed professional, they have a protocol that they follow in order to keep their license. So here, if you look at the very beginning, it starts with an intervention. There was an intervention that happened during that time. Then we go into a comprehensive evaluation. They get an evaluation. Then they go into detox, 90 to 180-day residential treatment, individual and group therapy, family counseling, 12-step meetings, professional Pacific peer groups, life skills training, and again, for me, in my opinion, the most important, random drug testing to back up that evidence base that we always talk about. I don't trust the ones from intervention or self-reporting, but these type of programs I really trust because they're random drug testing where they call in every day, Monday through Friday, and if it's their day to test, they go down into the local lab and they leave a sample. And then relapse and prevention planning. So with those statistics, or with that treatment protocol, again, the intervention show only has a pre-intervention and intervention and treatment, so it's 55%. With this complete treatment protocol, we're able to reach 76%, 95% treatment. We did Dr. Greg Skipper, a lot of you may know of. He's done a study out of 904 physicians, 16 different states, over a 5-year period. 79% did not relapse, or are in that program, are doing well. Again, unheard of statistics. I have a great friend of mine, in Florida, and he went through the doctor's diversion program it was close to 30 years ago, and he's close to 30 years in recovery, living an amazing life because of this program, because of what we just talked about. I'll go back to that slide so you could see he did all of these different components down in Florida, and he was able to stay sober for close to 30 years now. So that's where I say the secret is, why doesn't the general public have this information? Why aren't they getting these numbers of success? If we go into the HIMSS program, the HIMSS program is designed for pilots. They have a similar program. It's a pre-intervention and intervention. They have treatment, a minimum of 90 days. They go into weekly group aftercare meetings, monthly interviews, with trained flight managers and pilot peer committees. Again, the most important is random drug testing. So, you're going to hear me saying that a lot because I really believe that's the most important to get. If you're going to report on evidence base, let's see the random drug testing that's associated with that. So here they have the random drug testing, 12-step meetings, sponsor required, 90 meetings in 90 days, medical support oversight of continued 3 to 5 years in post-return duties. And if you relapse and you're part of the HIMSS program, that program will last the lifetime of your licensure. So I love it. There was a study done in the HIMSS program with United Airlines, over 4,500 pilots. With right now, they have a success rate, if you look down here, of a 92% long-term recovery rate of 2 years with less than 10% relapse. Again, unheard numbers for this disease. So, why aren't we giving the general public? Why are we not giving the general public these type of statistics? The insurance carriers, again, I'm going to talk a little bit more about the insurance carriers. They're upset that they're not getting these numbers from us as providers, which, I can't blame them. But they're devastated that we're not getting these type of numbers. I'll go over that in a bit. Before I get into that, I really wanted to talk about, for you, are you in private practice yourself? Another quick question. Are you in private practice yourself, or do you work with a treatment center or other while you're participating? I'd love to, again, see who I'm working with. And it looks like got a great number. Thank you so much for asking. We got treatment center and other private practice, a little bit less, so thank you for that. But with that being said, we have statistics that work. So I'm talking about a 5-year plan here, a 5-year plan. The doctor diversion program's a 5-year plan. The lawyers, all these plans are 5-year plan, and they're getting these high rates of success. There's other diseases out there, that we've heard of for many years. My mom's a cancer survivor, and there's a 5-year survival rate that we hear all the time. With them, they're getting great success rates because they're followed up for a certain protocol that they follow dealing with cancer. So if we look at addiction and we look at cancer or we look at diabetes or any other disease out there, there's a certain protocol that they all follow for a certain period of time. With diabetes, it's the lifetime of, pretty much your lifetime that you're monitoring that. But with cancer, they're aggressively monitoring it for a minimum of 5 years. And you all heard, I'm sure, of the 5-year survival rate. So when we normally get a patient, for an intervention, and you get a patient into your treatment center, or into your practice, it's not like cancer. Like the mark right here on this young woman's back, for cancer, that's when we're going in because we're educated right now with cancer what to look for. With this disease, the general public isn't educated on what to look for and to get treatment and early detection. So with cancer, some people will wait for this stage, some people will wait for that stage, as we move further along. But when I get involved, with an intervention and family calls me, it's more at this stage, late stage cancer. They're calling me with, the emergency lights going, and they are looking for that help that they desperately need for helping them with their loved one with an addiction. When you get somebody that comes into treatment, again, it's not in the early detection. They are coming into us in the later stages of our disease. So again, what we could do as treatment providers is educate the public for the earlier signs and try to get them into treatment. And I love that there's a lot of you on this right now that are in private practice, because I would love to see them getting treatment with you in the early stages. So I would, let's work harder on getting education out there. With the treatment model, there's, again, a certain protocol that is followed, that they go through. With our disease, we're not following. The problem is that we're not following a certain protocol. Like, this is a cancer model, recovery model. So every treatment center that you go to for cancer, they're following this treatment model. With our disease, we're all following different treatment models. We're not talking the same language to the general public. And what we're missing is the components of the doctor diversion programs, which I'll go over in more detail. And as we all know, addiction is a disease. It's not curable, but it is treatable. Then we go over to another saying with Greg Skipper, Dr. Skipper. He talks about, that, relapse is common, but it doesn't have to be common. It doesn't have to be common in our disease. If we put this treatment protocol that we're going into now with the 5-year plan, we could reach these high success rates. It doesn't have to be, part of recovery. And as he talks about also, treatment is a small beginning part of recovery. It's not the answer. And educating the public again that treatment is, only the very beginning. The success rate is, for treatment is a journey. There's no destination. Working with family members, you're not going to end up somewhere and be cured with this. Recovery is a journey. A lot of you that work with treatment centers, think about it. What are your rates of success rate for inpatient treatments? And what is the criteria that we're measuring the success rate? What is that criteria? What are we measuring? It's hard because, we don't have the same system in place as of yet. Hopefully in the next year or two, we will have this in place. But as of right now, we don't have the same system in place where we could measure them with random drug testing. But what is the measurable way that we are looking to get these success rates? If we go into the National Institute of Drug Addiction, they're telling us that only 3 to 7% are still sober after a year of a 30-day treatment program. So here they're telling us that, we're nowhere near the 70, the 60% in drug court, or even the 55% with the intervention show. We're nowhere near the success rate that we could be at if we all followed the same simple treatment protocol. Insurance support. Again, it's devastating. I know a lot of you as providers, unfortunately, we do not have the support with insurance at this time to follow the 5-year protocol. That seems to be one of the things that is, preventing us of giving this type of treatment that, the doctor diversion programs, the drug court programs, all of them that they're able to abide by. I'm going to talk a little bit over, there's a company that we started. It's called Independent Coalition of Treatment Providers, and it's a bunch of treatment centers that are going, we ended up just going to D.C. and, talking with them about, we ended up talking with the CMO, Chief Medical Officer of Humana. We talked to the CMO of Aetna. And then we also talked to a clinical manager at Cigna. We went to a payer conference out in Washington, D.C., actually in Virginia, but flew out to Washington, D.C., and we were invited out there with Tracy Collender, who is the Behavioral Health Executive Director of Joint Commission. And she invited us out there to come and sit down face-to-face with insurance carriers and, work together to create something that is going to help their clients and our patients. And I was amazed by the response. I mean, again, we went out with like 10 treatment centers and met with them, but the response that we got was just, incredible. There's no other word. It was incredible. They are really at their wits' end. What they're looking for is, they want these long-term success rates. They want these long-term recovery rates, and they've been paying for years, but they're not getting it. So I understand their frustration in all of this, and they want the evidence. They want the evidence. They want evidence-based treatment. They want to make sure that what they're doing and what they're paying for, they could get the same statistics that other people are getting. Again, like the doctor diversion and the lawyer's assistants and the drug courts. So what we did when we met with them is we said what we would like to do is to do a test pilot with all of you. And again, their response was welcoming. We would like to do a test pilot with you and do the whole the whole treatment protocol that we do with the doctor diversion programs. So we went over it with them about the different programs that we have. The A&E intervention, with the 55%, the physicians, high, 80s, the HIMSS program, 92%, and the drug courts in the 60%. So what they said is, well, Ken, you have the consequences with them, and I'm sure you're all saying the same thing. I get the same thing from all of you, is you have the consequence with every one of those programs. With the doctor diversion programs and the high licensed professionals, they have their license at stake. With the drug court, they have their freedom at stake. With the intervention that show that and the intervention that we do in our private practice, there's a lot of interventionists here. So, with the interventions that we do, we create those motivators, leverage, and consequences with the family system. So going over them is, finding out, what's going to motivate each individual. I did a presentation out in Mississippi, and Dr. Scott Hamilton is the medical director of the Mississippi Professional Health Program. And the way he presented it is that, every single addict out there, self-admit, every single person you are treating out there needs to have the carrot and the stick approach. Every single one of them. The reason why they walked in as, a person that's out there that's in a treatment center, no addict walks into your treatment center saying today's a beautiful day. They walk into your treatment center because there's been a stick that hit them in the back. There's been a consequence. There's been something that motivated them to want to look for a different way of life. So they check into treatment. Same thing with you that are in private practice that are participating today. Nobody walks into your office because it's a great day and they just got married. They come into your office because there's some crisis and some pain that they feel that makes them want to change. So his perception of this was they need the stick, but then also you need the carrot. And that's what we do in professional interventions is we create the carrot and the stick approach with the family system. So moving right along here, I got some extra slides here I want to go through before rush it along. So here we go into the model that seems to be working for the 5-year plan that they've been doing for over close to 30 years with the high licensed professionals is there's been an intervention. So if you have a self-admit patient that has come in, then we don't need to intervene on that patient, but what we do need to intervene is on the family system to support the family, to support the patient checking in, to either support their recovery process and point out to them how they have been supporting the addiction. So here we have intervention, reevaluate is at every term here, treatment placement. During the intervention, we do an evaluation, and the best one is to go into a treatment center and do an evaluation, get properly diagnosed, and then we could find the appropriate treatment placement. Then detox, treatment. Again, AMA is saying, a minimum of 90 days. And I get that 90 days insurance at this point won't pay for 90 days, but a lot of you have been so creative in making, the 90 days up with, sending them to IOP after they finish their 30 days of inpatient or 45, whatever the insurance will pay for. So being creative around that to make sure that they're able to get that 90 days. Then some form of sober living is really helpful because, they have their peer support around them. Intensive outpatient, as we talked about. But again, most important is the random drug testing. We need the random drug testing. Without the random drug testing, self-reporting from an addict really isn't the evidence base that insurance carriers are going to want to look for. And then the recovery advocate program, which is having a case manager that's, The case manager is somebody, as we move along, the case manager that we look at the 5-year timeline here is, intervention, inpatient treatment, intensive outpatient, sober living, life skills, recovery advocate. The recovery advocate is somebody that's carrying that torch from the very beginning. So here we are in the red where the intervention happens. What happens so frequently is when they change providers, and I love this because talking with Tracy Collender from, again, the executive director at Joint Commission this past week, they want to create a certification, and they are in the process of creating a certification that this case manager will have where they are able to oversee the changing of the guards, so to speak. So when they finish the intervention, who brings that information to the treatment center? Who brings the treatment center when they finish inpatient treatment? Who brings that to their intensive outpatient or their therapist back home? Who brings that information to their sober living if they end up going there? Who brings that information through this 5-year period as they move around the country to new therapists? Who brings all of this information along the ride, along the treatment protocol? That's where we're missing the buck. With the doctor diversion programs are called case managers. With the drug courts, they're either called case managers or parole officers. But somebody is carrying that torch and going through that 2 or 5 year protocol to make sure that they are consistent with their treatment. So again, it starts off with an intervention. The most important part, I've been working with a lot of treatment facilities, and the most important part of an intervention is we may not need to do an intervention on the patient. They are in treatment. I'm working with many, many families right now, and I'm working on the other end with intervening on them, educating them on how to write a family contract. This is what an intervention is, and this is what we're trying to, work with these insurance carriers. Like I said, the chief medical officers were really receptive to, us doing this, but intervening with the family system to work with them to create a family contract, figure out something that is going to motivate their loved one, create healthy boundaries to put into place that's going to help them stay participating in the recovery process. I just did a family program at a treatment center. I also do a lot of family programs at treatment centers, and I asked for somebody to come up front and to give us their history and work with us as a case study. And so this brave family stepped up to the plate, and everybody there realized that the patient was holding her breath. This was just this past weekend. Even the peers were raising their hand that she's holding her breath. So how do we break that? How do we break a patient holding their breath? I was able to work with the family system and put some consequences, and again, the carrot with the stick, some hopes in the family contract to create a situation that's going to get them motivated. So the 5-year plan also covers inpatient treatment. There's a lot of you providers with us in the presentation today, and thank you again. The inpatient treatment, you guys are doing an amazing job. You're working at so many different modalities and so many different ways to save these people from dying from this addiction and their disease. But again, if we were able to get them motivated with the family system, to put some consequences into place, we're gonna raise that success rate. So we go into the treatment, and we go into sober living. What we recommend for these young adults, especially, they've been out there using for years and years and years. If they're in their early 20s, they've probably been using since they've been 13 or 14 that end up in our treatment center. So there's no quick fix for them. It's a process, as we talked. There's no destination in recovery. It's a process. So we talk about sober living. We recommend that everybody goes to sober living for a minimum of a year. If you leave treatment, one of their treatment recommendations that all of you, I'm sure, is in your discharge plan, which should be called continuum care plan moving forward. So in your continuum care plan, you recommend 90 meetings in 90 days. And the purpose of that 90 meetings in 90 days is so they could get connected with their peers and, build a recovery platform. We see over and over and over again, they are not doing this. So sober living is so important that kind of helps them with their 90 meetings in 90 days, where they build that family of recovery. They have that foundation. Even if they have a family to go home to with kids at home, I recommend that they go in their home community to a sober living instead of going home right away. So we have the 5-year plan with sober living. Moving right along. I want to get to questions and answers and leave plenty of time for all of you. So intensive outpatient, we talked about that, the importance of, continuum therapy. They need the continuum therapy, for 3 years, some form of therapy. The random drug testing, I think I was pretty clear on that one. I don't think I need to keep reiterating the importance of random drug testing. And again, meeting with these executives with Cigna, Aetna, and Humana, they are open to creating something when they leave treatment for random drug testing. And then we go into the 12-step support group. Nobody does it alone. So the Recovery Advocate Program, again, I talked about the importance of that. The Recovery Advocate is the person that is going to follow that whole chart of the 5 years. They're going to go ahead and make sure that, somebody is working with that patient, with that family system, that they are following them and making sure that they are following every single thing that you guys recommend on a treatment plan. And if they are not following it, when I do an intervention and I work with a family program, with a family, using that family that we just talked about, I wouldn't say cut your daughter off if she's not going to her 90 meetings in 90 days after she gets out of treatment. I would come up with, I call it a step ladder approach. We create some form of a consequence. Well, then you're not getting your car, until you're able to, continue working your program of recovery, following your clinician's recommendations. So this recovery advocate is kind of like, I like to communicate it as, a wheel on a hub, or a hub of a wheel, a hub of a wheel. We have the advocate right here. The advocate is in contact with the drug testing company. They're in contact with the treatment center team. They're in contact with the psychiatrist, the identified person, the therapist. If they have a sponsor, they're talking to the sponsor. Again, most important, they're talking to the family and making sure that they're going to their 12-step meetings or whatever their treatment protocol is that you as clinicians, recommend. The recovery advocate is making sure that all of these spokes are moving smoothly. And the minute one of them snaps, they're able to bring it back on track where we could measure behaviors before the relapse happens to get them back on track, just like the doctor diversion program, just like the drug courts, get them back on track and remind them of the family consequences that are going to be coming down the road if they do not. So we're able to measure it a lot faster. So the benefit of having that advocate is not only, turning the information over, to the family program or to the all the rest of you. And again, we don't want to know the gory details of what happened in their trauma with their therapist. We don't want to know what happened in their 4-step of their program, their 12-step program with their sponsor. All they need to know, the advocate, is are they compliant or non-compliant. And then, of course, we talked about the carrot. The carrot is so important. Finding what means something to the individual. What is it that they love doing? Finding, things that are going to excite them to keep them in recovery. So the 5-year plan is you're able to use it in every addiction: gamblers, drug addiction, prescription addiction, and every single one of the addictions, alcohol, eating disorders. We're able to use the 5-year plan for every single one of these addictions. But the thing that's really important is that recovery needs a motivator. And the more that we could magnify the motivator, and again, as a therapist, I don't want you, thinking that I'm saying that, we're here to punish people, but this is more about getting them engaged in your process. Without a motivator, they're not coming in to see you. They're cured, they're better. So if we could magnify the motivator, to let them know, what I hear your family saying is, if you choose not to continue to move forward and work with me, then their consequences are A, B, and C. And I see that that's going to be really difficult for you with A, B, and C. And then going through with them, as they say in recovery, play the tape through. A really looks bad, B looks even worse, and oh my God, if C happens, I could only imagine what that would be like for you. So why don't we work together as a team to, really get some engagement with you, and let me help you get through this and be on your side. So it's a win-win on both ends. Recovery is a seamless continuum of care with many components. I think that as providers, we need to be explaining to the general public that it is a 5-year plan. When somebody calls me as an interventionist on the phone, when they call me, we talk about this being a 5-year plan. There is no quick fix. There's nothing out there that is going to, cure your loved one. It's a process, and we're here to help. And again, I told you I'd talk a little bit about the independent coalition of treatment providers. There's a bunch of treatment centers that we're working together to meet with the insurance carriers, to meet with commission, to just put a high level of standard of care, because again, the other thing that the general public does not know is who are the ones that are not doing what they should be doing, who are the ones that are taking advantage of these addicts out there. And we hear about it all the time in the industry. So we came together as a coalition it was at the Moments to Change, not this past year, but the year before. A bunch of us met there, and we, created this coalition. I mean, coming together and looking, and that's what I love about, those conferences that, Foundation puts on with the different ones all over the country, finding the ones that are doing this right, joining together, asking the insurance company, Joint Commission, to all come together and create that message that we are the ones doing this right, and we want to help save lives and get a 5-year plan paid for. And again, treatment providers are willing, the payers. Treatment payers are interested in hearing what we have to do and are also willing to move forward with us on a trial basis to see if this will work, for the general public and their patients, their clients. They are just as upset as we are. They are not giving, from what they told us, they are not giving their clients the help that they need to fight this battle of addiction. So if all of us get together, we speak the same language of the 5-year plan, we can make a difference. And with that being said, I think I'm right on time. I will pass this back over to Julie, and thank you very much.
Fantastic. Ken, thank you. What a great presentation. Before we get to the Q&A portion of today's event, I'd like to hand things over to Melanie Melcher from Foundations for a few words from our sponsor.
Thanks, Julie. Here at Foundations Recovery Network, our grassroots movement called Heroes in Recovery has a simple mission: to eliminate the social stigma that keeps addicted individuals from seeking help, to share stories of recovery for the purpose of encouragement and inspiration, and to create an engaged, sober community that empowers people to get involved, give back, and live healthy, active lives. Join us in this mission at our 6K race series at these locations across the country. As a thank you for your attendance today, please enjoy the $10 off discount code Webinar 2015 to register for any future 6K event. Back to you, Julie.
Thank you so much, Melanie. And we've had a number of great questions come in from the audience, but we'd like to remind you that you can use the Q&A widget below the slides on the screen to submit your question at any time. All right, Ken, let's dig in. Someone in our audience would like to know, do the demographics make a difference? The everyday person with addiction is usually at or below poverty level. Does that have anything to do with the low success numbers?
Actually, no, because, treatment is available for everyone. I mean, there's treatment facilities all over the country. I mean, U-Turn for Christ is, I think, $600 or $800 and has a great program. Salvation Army has a great program, which is free. So, it really doesn't matter. My belief is, addiction is not prejudiced. It hits all walks of life. Yes, the ones that have the financial resources, they're able to afford the recovery advocate, to follow them for the 5 years, which insurance hopefully will start paying for. But no, Salvation Army is, there's many missions out there that are, 12 to 18 months long that are getting, long-term success rates because, again, it's all about long-term care. It's not about a quick fix. So I believe, no, this disease is not prejudiced. It hits every single person out there. Everybody knows somebody.
Absolutely. And someone in our audience asks, what forms of consequences would you suggest for a positive random drug screen for members in the program?
Okay, so that's a very complex question because it has so many different components. So it depends on, number one, the individual that, tested positive. So what would mean something? I'll give you 2 examples that, would mean something. So one of them, it may be that we take away their cell phone. That means a lot to these young adults. They lose their cell phone until they get re-engaged in their program. And that's been very effective for young adults. We turn off computer access. The families take away their computer. They stop paying for their school, or they, let them know that that's going to be next if they don't get re-engaged with their program. One of the ones that we had, and this is the benefit of having a recovery advocate, is we had a positive test on one of our clients. And we checked with the therapist, and they said, no, he's been doing great. We checked with the psychiatrist. No, he's been coming in, showing for appointments, taking medication, did blood work recently, and all meds are being taken. Checked with sponsor and AA. No, he's doing his steps, doing great. So we were wondering what happened, and what we realized that it was a false positive. So if when somebody does test positive, you really have to make sure that, number one, it is a positive, and number two, if there are consequences that need to happen, again, it needs to be a stepladder approach, and every single addict, I look at it as every addict out there is like our thumbprints. We're all completely different. So the motivators that keep us engaged in recovery are going to be completely different. And again, that's the most important, and the reason an intervention on the family system is so necessary.
Great. And now you talked a little bit about the sticks, if you will, but what about the carrots? I know you mentioned things like taking the cell phone away, but what might be some of the incentives? Can you give us a few examples?
Of course. I love that one because, a lot of them, they lose their families. Like that young woman I was talking about, the only reason why she went to treatment is her father and her brother said, we are done with you. We've paid for treatment enough. We're walking away. So that was the stick. But the carrot was, as long as she stays in recovery, she has her full family love and support. They will be there, and they will be a part of the family program. They will do everything necessary. If she wants them there, they will be there, whatever she needs. So making sure, and if they're going to pay for school moving forward, whatever that is going to look like, but also having fun in recovery, doing things like they put in their family contract that she's going to continue with her singing lessons because she loves to sing. And, she's going to continue, doing her yoga part of that family contract because, that always has a positive effect for her down the road. And these are things that she really enjoys. So carrots are just as important than as the stick.
Fantastic. And someone in our audience asks, what is the response you've seen from patients who definitely want to have treatment, but they feel like they really can't leave work for it? Is there a way, that's a pretty daunting proposition, a 5-year plan for someone who maybe has a full-time job and feels like, how are they going to do all this? What kind of advice do you have for someone with patients like that?
What I always recommend is, what if you got in a car accident today and you were driving down the highway and, got in a collision and ended up in a coma and ended up in the hospital for a month? What would happen then? Your job would wait for you. You would still be there. You would be able to take that time off and hopefully recover and go through that process and, get back to work. The same thing's true with an addiction. If you have a medical condition and you have a note from the treatment facility, the same thing's true. Your job, 99% of the time that I've dealt with families, the job will wait for them. They know something isn't right. And it doesn't have to be where you say, oh, my God, I'm a heroin addict and I can't stop shooting up heroin. Of course, they're not going to want somebody like that back. They're going to be like, oh, my God, how do we protect our company and keep them out of here? But they could say, you know what, I feel like I've been drinking a little bit too much on the weekends, and I did an assessment at a treatment facility, and I meet the criteria, and insurance is going to pay for it, and I really think I need to check in and get the help. And so here's a letter from the facility that I'm at, and I'm going to make sure that I nip this in the butt before it gets too bad. So when you present it that way to an employer, they look at it as more of a positive, that you're, aggressively taking action on your illness and stepping ahead of it instead of waiting for it to get really bad.
Great. And a number of people in our audience have asked specifically about spirituality. Where in the 5-year plan do you see spirituality fitting in, if at all?
Oh my God, I love that question. That's my favorite. Well, actually, before this and every day, I get up and meditate, and I celebrated this past year over 26 years of recovery, and that is so important. Spirituality. I don't think it's really possible to get long-term recovery if you can't, grab onto some form of spirituality, in my personal opinion. But I think that is the key component. Spirituality. When I do interventions, I always talk about the motivators that motivates people to get in. I spell it out as HELPS, HELPS. So the first one is health. Something happens to them physically that they seek out help. Their liver goes jaundice and the doctor tells them you have to stop drinking. They'll seek help. An emotional rock bottom. That's the family system coming together to create an emotional rock bottom. A legal rock bottom. A lot of people got a nudge from the judge, as we like to call it. So a legal rock bottom is a huge motivator. And then personal finances. How are they keeping it alive financially? And then the last one is spiritual. A spiritual rock bottom. Creating a family contract, we have no control over their health or their spirituality, but something magical happens in that 5-year plan. There's a saying, you fake it till you make it. So in that 5-year plan, working a program with the family having the stick and the carrot, negotiating which, not negotiating, but working, it's very fluid, the disease, so working with the family system on, which one to be doing, the carrot or the stick, but working with them, something magical happens where it becomes spiritual. That click happens where they say, I love my life better now than I was when I was in my disease. And the reason why it's a 5-year plan is the doctor diversion programs used to be 3 years, but what they realized is they held their breath until they were off the diversion program and they started getting loaded again. But the magic happened between 3 to 5. So that's why we have the 5-year plan.
Great. And you talked about having the family involved. Can you describe a little bit of what the family contract might look like, what might be included in there? And then also, too, as a follow-up, can you talk about what if the client doesn't have any family or any natural supports because they've burnt all their bridges or they simply don't have any family?
Yeah, great question. I mean, the family's contract is always different. Like I said, I just did the family group and the family emailed me the contract and it was like 2% done. They had some really good consequences in there. And like I said, some motivator, carrots with her doing yoga and singing, but it was only 5% done. You really got to dig in the family system. So working with a professional is why it's so important, is really digging in the family system to create that contract. One time it was, we said, well, while you're in treatment, the dog, it was their dog. They didn't care about their family system. They only cared about seeing their dog. So, when you get finished with recovery, you'll get your dog back. So that got them really motivated. So again, putting what's in the contract is like a fingerprint. I can't do it until I work with the whole family and figure out what that is. I have some studies also. I think the studies are in our website in the Independent Coalition of Treatment Providers. There's a website, but we have studies that have been done that with family involvement, it raises the success rate up to another 50%. So if we're at 20, 30% as a treatment center, now we bring it up to bringing the family in with the carrot and the stick. Now we're up to another 50. We're getting 70 to 80% success rates. So the family is a huge component, and there's been studies out there. Again, email me. The last slide has my email address. So anybody that wants that information, I could email it to them. But the studies out there are showing that we need the family support. Unfortunately, yes, addicts, have burned some bridges with their families and they want nothing to do with them. Or worst case scenario, they don't have any family. They don't have any family. I have a good friend. His parents both died, and he has an aunt that's a distant aunt. Some people just don't have any family to have this support, and that's what really breaks my heart. Because you do need a motivation to get into recovery. So what I say is anybody that loves you and cares about you, friends, colleagues at work, anybody that loves and cares about you, bring them in on creating this contract. Bring them in and have them become your family, because we could also do it that way too.
Great, and that is a fantastic thought to end on today. Unfortunately, we don't have time for any more questions, but we do have some final instructions regarding CE credit. And again, should you have any issues with this process, we ask that you do not reach out to today's sponsor. They will not be able to assist you in receiving your certificate. But to receive your certificate for today's program, please click on the green Program Evaluation widget, complete the evaluation form, and click Submit. For those watching in a group, as a reminder, please download the group submission guide and program evaluation located in the resources area and follow the instructions provided. For those watching on a mobile device or a tablet, you will need to email the help desk to receive a program evaluation and certificate for this program. Please note that CE credit is not available for the archived webinar, and it is only available for today's live event. If you have any questions, please click on the purple Contact Webinar Help Desk widget at the bottom of the screen. If you enjoyed today's program, please join us again for 2 upcoming addiction professional webinars sponsored by Foundations Recovery Network along with Millennium Health. One is on Tuesday, November 24th, and the program is Treatment Plans for the Difficult Patient. It is presented by Jennifer Angier. And then on Tuesday, December 15th, the program is Trans 101, Making Treatment Safe for Transgender Clients, which is presented by Beck G. Cohen. Links will appear on your screen in just a moment for you to register for these programs. You can also register for these events by clicking on the purple widgets at the bottom right of the screen that say Register for the next AP webinar sponsored by Foundations. And I would like to thank Ken Seeley once again for an excellent presentation. I would also like to thank Millennium Health for making today's Foundation Recovery Network program possible. And finally, thank you to everyone in our audience for participating today. We do hope that you'll join us again in the future for another Addiction Professional webinar. This concludes today's presentation.